Hey class, how y'all doing? It's me, your favorite teacher, Miss Gordon. I pray all is well with each and every one of you. So we're gonna get right into it for class tonight. We're doing chapter 3, which is infection control, safety, first aid, and personal wellness. All right, and then of course I'll give you your assignments. Okay. So we're going to get right into it. All right. So your objectives are going to be able to demonstrate the knowledge of terminology, precautions, procedures, practices, and programs related to infection control, and identify associated agencies. You're going to be able to identify key elements of the Occupational Safety and Health Administration, Bloodborne Pathogen Standard, and the Needle Stick Safety and Prevention Act, and identify associated agencies. And you're going to be able to identify general laboratory safety rules and safety rules that apply while in patient rooms and other patient areas. You're going to also be able to identify hazards, warning signs, safety rules, and agencies associated with biological, chemical, electrical, fire, and radiation safety, and discuss actions to take if hazardous incidents occur. You'll be able to recognize symptoms requiring first aid and list the main points of the American Heart Association, short AHA, cardiopulmonary resuscitation and emergency cardiovascular care, ECC, guidelines. You'll be able to describe the role of personal wellness as it relates to nutrition, rest, exercise, stress management, and back protection. Okay? Okay, starting with infection control. Infection is a condition that results when a microorganism, or a microbe for short, is able to invade the body, multiply, and cause injury or disease. So microbes include bacteria, fungi, protozoa, and viruses. A pathogen is a microbe capable of causing disease. So, understanding infection control is important to protect yourself, your patients, your co-workers, and others from infection or injury, to react quickly and skillfully in emergency situations, and to provide the best patient care. The types of infections are communicable, which is able to spread from person to person. The CDC investigates and controls communicable diseases and epidemics. Nosocomial and healthcare associated infections, for short HAIs. The infections acquired in the hospitals and other healthcare settings. 1 in 25 hospitalized patients in the United States has at least one HAI, and more than 1 million occur each year, costing billions of dollars annually. And it is caused by infected personnel, patients, visitors, food, drugs, or equipment. Your antibiotic-resistant infections are well-established antibiotic-resistant bacteria. C. diff, also called Clostridium difficile, MRSA, also known as MRSA, and Enterococcus. Okay? Drug-resistant gram-negative bacteria, carbapenem-resistant, Enterobacteria CRE, Escherichia coli, known as E. coli, and Klebsiella pneumonia. Acinetobacter baumannii, these words is crazy, y'all, you hear me? And Pseudomonas aeruginosa. Good thing we don't have to say these words every day. All right. So your chain of infection is your infectious or causative agent, which is a pathogenic microbe that is responsible for causing an infection. You have your reservoir, which is the source of the infectious agent, a place where a microbe can survive and grow or multiply, and it includes humans, animals, food, water, soil, and equipment. Then you have your exit pathway, which is a way an infectious agent is able to leave a reservoir host through secretions and exudates, tissue specimens, blood, feces, and urine. Number 4 is your means of transmission. Now, these are the ones that y'all gonna have to pay attention to when y'all are in places like hospitals and stuff like that, because these are gonna be your isolation signs that's on your doors before you go into patients' rooms. So please pay attention. So you have airborne contact. Airborne is sanitary, through the air. Contact is through direct, which is touching or kissing, or indirect, which is contaminated objects. Then you have droplet, which is coughing or sneezing. Then you have vector, which is insect, arthropod, or animal. And then you have vehicle, which is food, water, or drugs. The most common type of HAI reported to NHSN is urinary tract infection, UTI, accounting for over 30% of all HAIs. Okay, so moving right along. Number 5 is your entry pathway. It's the way an infectious agent enters a susceptible host, and it includes body orifices, mucous membranes, and breaks in the skin. A susceptible host is someone with a decreased ability to resist infection. Factors are age, health, and immune status. So it's very important for you all to keep up with your health and your immunity. You got to keep up with those things, because once we're in the field that we're in, we're open to a lot of germs, because we dealing with every and anybody that come into the facility. So therefore, you want to make sure that you up on your health, so that if you do come in contact with some germs, it won't take you out or knock you down. Okay? So all of those things work together. You have your infectious agent, which is your bacteria, your fungus, your protozoan, your Rickettsia virus. You have your reservoir animal, which is human, equipment, food, water, or soil. The exit pathway, which is blood, exudates, excretions, or secretions. Then you have your means of transmission: airborne, contact, droplet, vector, or vehicle. Then you have your entry pathway through your body orifices, your mucous membranes, or broken skin. Then you have your susceptible host, which is the elderly, newborns, acute or chronically ill, immune suppressed, or unvaccinated people. Okay? Okay, so breaking the chain of infection, you have to do hand hygiene. That's number 1. Okay. Nutrition, rest, and stress reduction. Immunizations. You must be on top of those things, which immunizations. I can't even talk today, y'all. Decontamination of surfaces and instruments, meaning when you use your things, wipe them down before and after you use them. Disposal of sharps and infectious waste, putting stuff in the appropriate containers, not throwing needles in the regular trash can, but throwing them in the biohazard container. Use of gowns, gloves, masks, and respirators. That's all part of your PPE, your personal protective equipment. It is there to protect you. Use it. Your gowns, your gloves, your mask, your respirators, your N95 masks, your masks with your shields, all of those things. So, This is a mask. See, you got your mask and your shield to protect you. Okay? This is an N95. Let me take off my glasses so I can show you. Okay? And when you put it on, it's snugly fit, so nothing can get in to harm you. Okay? Use your stuff. Alright? They have it for you. Use it. You have to protect yourself. Needle safety devices. That's when now they have them years ago, and even as probably as early as last year or the year before. They have the needles that don't have the safety attachment to it. But because many people unfortunately had needle sticks trying to recap the needle, now they have it where the safety device is on the needle. So as soon as you pull it out, bam, you put this on. That protects you, that protects your patient as well. Infection control programs. Whatever programs they have to keep infection down. Wiping stuff down, making sure that they're making sure the stuff is up to par, making sure everything is what it's supposed to be. You have insect and rodent control. You know, anytime you have a place that got food, you know you have a chance that you're going to deal with insects and rodents. So you have to make sure, well, y'all don't have to make sure, but it's made sure that the appropriate personnel will take care of those things so that you don't have to worry about rodents and insects, you know, while you at work. Isolation procedures. Once again, I'm going to stress this to you from now till y'all get out the class. Isolation. Pay attention. What y'all hear me say all the time. I don't even want my own germs. I darn sure don't want nobody else's. So please, pay attention to your precaution signs and do what it tells you to do before you enter the rooms, okay? All right, so infection control programs. They are in to protect the patients, the employees, the visitors, and others. They are put as to break the chain of infection. Try to keep infection close to down, as close to a minimal as possible. Monitors and collects data on all infections occurring institution. Institutes special precautions in the event of outbreaks. Components, employee screening, employee immunization, evaluation and treatment, and surveillance. Now, the infection control practices. You need hand hygiene. That's going to always and probably forever will be numero uno. Hygiene. Use of alcohol-based antiseptic hand cleaners or hand washing. About the sanitizer. That's in every hospital, every doctor's office, darn near everywhere now. Inside, outside of each patient room, and we even keep our own on the cart. So they make sure that you're constantly sanitizing your hands. Your PPE, your personal protective equipment. That's your gowns, your gloves, your lab coats, your face masks, your shields, your goggles, and your respirators. So, glove removal. When y'all come back to class on Tuesday, we will start with glove removal so you can see how to do it. It's a picture on there, but of course we're not in class, so I can't show you. So I'll show you on Tuesday. If the Lord's willing, then we make it. Alright? But glove use need for hand hygiene. You still have to clean your hands. Hands should be sanitized immediately after glove removal and before going to another patient, back to the laboratory, or performing other duties. Okay, so you should be like sanitizing like you're crazy. All right. All right. The respirator is similar to the mask I showed you, but it's the one that cover right here. Okay, it fit just like this. That's the respirator. Now, order for donning your PPE. That means the order that you put your personal protective equipment on. You should do your gown first, then your mask or your respirator, whichever one you're using, then your goggles or your face shield if it requires it, and then your gloves. Okay? The order for removing your PPE should be your gloves first, inside out, which I'll show you on Tuesday, then your goggles or your face shield, then your gown, and then your mask, touching only the strings. Okay? Then you make sure you wash your hands or sanitize. So your lab coats worn as PPE must not be worn on break, in the break room, in the cafeteria, or other non-patient areas, or outside the hospital. So it should be worn only while you're working. Okay? Aseptic tech for blood collection personnel. Proper hand hygiene. We'll go over that next week. Prevent dropping supplies. Opening packages to avoid contamination. If you're not using it, don't open it. Prompt and safe disposal of contaminated. Prompt and safe means you're not walking around holding a needle in your hand. Put it in the biohazard container where it's supposed to be. Okay? Prompt cleanup of infectious material. Clean up your area when you're done. Make sure you're not leaving stuff in the patient's bed, in the patient's room, in the chair. Just make sure you're thoroughly cleaning up. Wearing your gloves for blood collection and other PPE when indicated. In other words, always wear your gloves. The NICU infection control technique. Gather all your items to perform your special collection, just like you do with any other collection. Gather all your items. Then leave the blood collection tray cart outside the nursery. So you're just going to take what you need in the nursery. That's it. Then you'll decontaminate your hands and put on new gloves between patients. Okay? Even with your isolation rooms and your contamination rooms, do not take your cart in that room. Take what you need in the room with you. If you had to take extra tube, extra needle, extra gauze, alcohol, or tape, or whatever, just in case, let's say a tube don't work or whatever, you can have it right on your person. But don't take your cart in none of the isolated areas. Okay? None of the contaminated rooms. You are not to take your cart in those. Isolation procedures overview. Keep your patients with communicable infections separate from others. Generally, that's what they do anyway. We don't have to do that. They normally put them, in a room by themselves or on a floor by themselves or something like that. You want to always prevent the spread of infection. Always protect your patients with compromised immune systems. You always want to isolation requires a doctor. It requires a doctor's order for isolation. And the infected patient is confined to a private room. Generally, they're usually by themselves. Okay, so scrubs or other pants that touch the floor can easily pick up infectious material. According to the CLSI laboratory safety guidelines, pants worn by laboratory personnel should be 1 to 1.5 inches off the floor to prevent contamination. Don't be walking around with your pants legs. No dragging of the pants legs. Okay? I hope that this thing is really y'all getting everything, because I'm noticing that it keeps pausing in between my talking. If I repeat something, that's why, because I want to make sure you get what I'm saying. Okay, so isolation procedures. Protective/reverse isolation. That is for patients that are highly susceptible to infections. Universal precautions. That is, blood and body fluids of all people are potentially infectious. And body substance isolation goes beyond universal precautions. You need gloves for contacting moist body substances. Okay? But like I said, you should be wearing gloves for everything. Everything. You should be having your gloves on. You shouldn't be touching nobody without your gloves, infection or not. Okay, so your guidelines for isolation procedures, you have your standard precautions, which is used for all patients. The number one strategy for control of nosocomial infection covers blood, all body fluids, skin breaks, and mucous membranes. Transmission-based precautions are used for patients known or suspected to have certain infections. There are three types. You have your airborne, your droplet, and your contact. Biohazard, which you'll get familiar with that symbol. It is any material or substance potentially harmful to health, and it should be identified by the symbol. You will get used to seeing that symbol, I promise. Okay, bioexposure routes. You have your airborne, which is through the air. You have your ingestion through the mouth. You have non-intact skin. You have percutaneous, which is through the skin. And you have permucosal, which is through the mucous membranes, like your eyes and stuff like that. Okay? Bloodborne pathogens. You got your hepatitis B virus, or HBV for short. And you got your hepatitis D virus. So your best defense is your hepatitis B vaccination. HBV exposure hazards. It presents in blood and other body fluids. It can survive up to a week on objects, and it is transmitted through via needles and sexual contact. Needle sticks and sexual contact is how hepatitis B is transmitted. The symptoms: flu-like, fatigue, loss of appetite, mild fever, muscle, joint, or abdominal pain, nausea, and vomiting. Hepatitis, or HCV for short, hepatitis C exposure hazards. Present in blood and serum, sometimes saliva. Infection primarily occurs after large or multiple exposures, and it is transmitted via needle sticks and sexual contact as well. The symptoms: flu-like, fatigue, loss of appetite, mild fever, muscle, joint, abdominal pain, nausea, vomiting. Human immunodeficiency virus, HIV for short. The exposure is present in blood, semen, saliva, tears, urine, CSF, which is cerebral spinal fluid, cerebral spinal fluid, amniotic fluid, breast milk, cervical secretions, and tissue. The risk to HCWs is primarily through exposure to blood. The symptoms: progression through mild to severe flu-like symptoms, hairy leukoplakia, white lesion on the tongue, glaucoma, neurological symptoms, and dementia. Now, because this thing keeps kind of pausing, if there's anything that I'm saying that you all miss, please write it down so that when you come back to class next week, I can kind of just reinforce it. Write it down, please, so that I can reinforce it when you come back to class, okay? Or even if you just have just some questions. OSHA standard for blood-borne pathogens, BBPs. It is enforced by federal law. It is intended to reduce, eliminate occupational exposure to blood-borne pathogens. intended to reduce or eliminate occupational exposure to bloodborne pathogens. It requires the use of engineering and work practice controls to prevent exposure incidents, availability and use of PPE, special training, medical surveillance, availability of vaccination against HBV for all at-risk personnel. Needle Stick Safety and Prevention Act require OSHA to revise the bloodborne pathogen standards in 4 key areas. Number 1, revision and updating of the exposure control plan. Number 2, solicitation of employee input in selecting engineering and work practice controls. Number 3, modification of definitions relating to engineering controls. Modification of definitions relating to engineering controls. Number 4, new record keeping requirements, including the requirement to keep a Sharps injury log. Exposure control plan must be written, must be reviewed and updated at least annually. Non-managerial employees with risk of exposure must be involved in identification, review, and selection. The BBP, bloodborne pathogens exposure routes. The skin is pierced by a contaminated needle or sharp object. Blood or other body fluid splashes in the eyes, nose, or mouth. Blood or other body fluid contacts cut, scratch, or abrasion. A human bite breaks the skin. Exposure incident procedure. If there's a needle stick or other sharp injury, carefully remove shards of glass or other objects and then wash the site with soap and water at least 30 seconds. Mucous membrane exposure. Flush the site with water or sterile saline at least 10 minutes. Use eye wash station if available to flush a splash to the eyes. Remove contact lenses as soon as possible and disinfect them. Knowing me, I be done threw them Jones out. I wouldn't even take a chance. So you're going to report the incident to your immediate supervisor, and you're going to report directly to the provider for evaluation, treatment, and counseling. Surface decontamination. That is also required by OSHA. All surfaces and specimen collection and processing areas, 1 to 10 bleach solution or other disinfectant by the 1 to 10 bleach solution or other disinfectant approved by the EPA. This is getting on my nerves. Cleanup of body fluid spills. EPA approved chemical solutions and kits. Gloves must be worn. Absorb material without spreading it over a wider area. Biohazard waste disposal. All non-reusable items contaminated with blood or body fluids go in biohazard waste containers. The general rules: always wear your PPE and always clean up chemical spills properly. Never store chemicals above eye level. Never add water to acid. Never indiscriminately mix chemicals together. Like, who would do that and why? Never store chemicals in unlabeled containers. Pour chemicals into dirty containers. Use chemicals in ways and never use chemicals in ways they were not intended. OSHA Hazard Communication Standard, which is HAZCOM and HCS. HAZCOM labeling requirements: the statement of warning, which is like a danger or a poison sign. Statement of hazard, which is a toxic, flammable, or combustible sign. precautions to eliminate risk, first aid measures for spills or other exposures, the safety data sheet, your SDS, which is general precautionary and emergency info on a product. So there's an example of the Department of Transportation hazardous material label. We'll go over that on Tuesday. The National Fire Protection Association labeling system. We'll go over that on Tuesday. Then it shows you in more detail. Safety showers and eye wash stations. Everywhere should have it. The phlebotomist should know the location of each of them. And is used for chemical spill or splashes to the eyes or the body. Flush affected part with water at least 15 minutes and then visit the ER for evaluation. The spill cleanup kit. I'll show you that on Tuesday. Actions to take if electric shock occurs. Shut off the source of electricity. Or use non-conducting item to remove source of electricity from the victim. Call for medical assistance. Start cardiopulmonary resuscitation if needed, and keep the victim warm. All employees should know the procedures to follow in case of a fire. All employees should know the location of the fire extinguishers and how to use them. All employees should know the location of fire blankets, heavy towels, and how to use them. All employees should know the location of emergency exits, and evacuation routes. The components needed for a fire to occur is fuel, which is combustible material, heat, which raises the temperature of material until ignition, oxygen to maintain combustion, and chemical reaction produces the fire. Keep the components apart to prevent fire. You have your fire to Tetrahedron. We'll go over that on Tuesday because I have to show you. All right, so you have different classes of fire. Class A. Class A is your ordinary combustible materials like wood or paper. It requires water or water-based solutions to extinguish it. Class B is your flammable liquids and your vapors, like your paint, oil, grease, gasoline. It requires blocking oxygen or smothering to extinguish. Class C is your electrical equipment. It requires non-conducting agents to extinguish. Class D is your combustible or reactive metals, like your sodium, potassium, magnesium, or lithium. It requires dry powder agents or sand to extinguish. Then you have your Class K, which is your high temperature cooking oils or greases or fats. And they require agents that prevent splashing and cool and smother fire. Okay, so your radiation hazard symbol, you'll see that next week as well. The principles of radiation exposure is distance, shielding, and time. Your radiation are present in patients injected with radioactive dyes, specimens from radiology or nuclear medicine, radioimmunoassay area. Okay? External hemorrhage. External hemorrhage is abnormal or profuse bleeding, meaning uncontrollable bleeding. Okay? The treatment is a firm direct pressure to the wound using cloth or gauze. That's why generally after you draw blood, you apply pressure so that it don't bleed out. Elastic bandage can be used to hold compress in place, and only use the tourniquet as a last resort. Compress should not be removed when adding additional ones because removal can disrupt the clotting process. What that means if you have a situation where someone's bleeding, let's say their skin is torn really bad, and you put gauze on it, generally, because it's dry, the gauze, the tissue, the shirt, whatever it is, will stick to what's wet. And then the clotting process will still begin. So instead of taking it off and possibly tearing the skin again and causing it to bleed more, what they're saying is when you have one there, just put another one on top of that one. Don't try to take the first one off. Don't try to take the first one off. Just add two, okay, as much as you need to till you get to safety or to a medical professional. It didn't stop this much, I don't think, when I did this on Tuesday. It's just pausing so much today. All right, shock. Shock is when insufficient return of blood to the heart results in an inadequate supply of oxygen to the body organs and tissues. It is caused by hemorrhage, heart attack, trauma, and drug reactions. Symptoms: pale, cold skin, rapid, weak pulse, pale, cold, or clammy skin, rapid or weak pulse, increased or shallow breathing rate, expressionless face and staring eyes. First aid: you need to maintain an open airway for the victim. Call for assistance. Keep lying down with head lower than the rest of the body. Control the bleeding or other cause of shock and keep the victim warm until help arrives. Training recommended by AHA for healthcare professionals. You have to have 6 to 8 hours of basic life-saving healthcare provider course. You have to take that course. It includes CPR, use of the automatic defibrillator, removing airway obstruction, and the certification is good for 2 years. The AHA CPR and ECC. The AHA CPR and ECC guideline updates: hand only CPR for lay rescuers. 100 per minute compression rate. Infant and child compression depth of 1/2 anterior to posterior chest diameter. Allow complete chest recoil between compressions. The AHA guidelines for an adult. Compression rate is 100 to 120 per minute. The compression depth is 5 to 6 centimeters. Full coil after each compression, minimizing frequency and duration of interruptions and compressions, and the ventilation rate of 2 1-second breaths after 30 compressions. We definitely got to go over this on Tuesday because this thing keeps messing up. The guidelines for infant child. CPR beginning with 30 compressions or 15 compressions if it's 2, 30 if it's 1. The compression depth at least 1/3 the anterior, posterior diameter of the chest. Compression rate 100 to 120 per minute, and both compressions and rescue breaths if possible. The chain of survival. In the hospital, cardiac arrest. Surveillance and prevention. Recognition and activation of emergency response system. Immediate high quality CPR. Rapid defibrillation. Advanced life support and post-arrest care. Out of the hospital, cardiac arrest. Recognition and activation of emergency response system. Immediate high quality CPR. Rapid defibrillation. Basic and advanced EMS. Advanced life support and post-arrest care. It is not personal wellness. It is not just about what you eat, but it requires a holistic approach, one that meets the physical, emotional, social, spiritual, and economic needs. Proper nutrition. Plant-based diet rich in variety of vegetables, fruits, and legumes. Avoid processed, starchy staple foods. Balance of carbohydrate, fat, protein, vitamins, minerals, and fiber. Rest and exercise. Lack of rest and sleep can lead to fatigue and other medical problems. Stay fit to be healthier and live longer. Focus on strength, flexibility, and endurance. Personal hygiene. Shower or bathe regularly. Use deodorant, but no heavily scented lotions or colognes. Brush your teeth and use mouthwash several times a day. Hair clean and neat, and fingernails clean, short, and neatly trimmed. Back protection. Use proper lifting techniques. Stress management. Chronic stress may weaken the immune system and be associated with hypertension, ulcers, migraines, and nervous breakdowns. So the healthcare workers are at risk for back injury because of activities they are required to do. Example, lift and move patients, and because of the stressful environment often associated with healthcare today. We are constantly bending, so we need to be mindful. Lift the bed, lower the bed, get on your knee, whatever it takes to get you where you need to get what you got to get done. Okay? All right. Any questions? Probably so. So if it is, please write your questions down and bring them to me on Tuesday. Okay? So, homework assignment for chapter 3. We have so we have matching 3-1 on page 40. Knowledge drill 3-1 on page 48. Knowledge drill 3-2 on page 49. Skills drill 3-3 on page 55. Chapter review on page 57 to 58. And that is it for chapter 3. Okay? So, that is it for chapter 3, you all. Okay? Y'all have the whole weekend to get caught up on your workbook. Please read. Oh, you know what? Let me quickly tell you. All right, page 3 starts on page 60. Chapter 3 starts on page 60. So you're going to highlight on page 61 infection control, infection, communicable infections, because you're going to read all of this stuff anyway. The chain of infection on page 63. Okay. 63, I want you to highlight, on 64, I want you to highlight infectious agent, reservoir, exit pathway, means of transmission, airborne transmission, contact transmission, droplet transmission on 65, vector transmission, vehicle transmission, entry pathway, susceptible host. I need you to do those because those are the things that we're going to we'll be in contact with daily when we're on the floors. So you definitely need to know those, okay? Let's see what else. On page 66, employee immunization. On 66.3.1, those are the CDC recommended vaccines for healthcare workers. Okay. Okay, on 67. Did I say 61? I meant 66 is the CDC recommended vaccines for healthcare workers. 67, your infection control practices. Okay, hand hygiene, numero uno. All right. Use of alcohol-based antiseptic hand cleaners. Page 68, hand washing. Mandatory. Okay, so on 68 and 69, we'll go over it on Tuesday. It's the hand washing technique, okay? But you can read through it in your book, 68 and 69. Also, 70, your PPE, personal protective equipment, highlighted. Gloves, highlighted. Proper glove fit and use. Read that, because there's so many people that when they put on gloves, they're too big. And they're too busy pulling on them like this the whole time they trying to put the needle on or whatever they doing. If you got to keep pulling on the glove, it's too big. And you risk an injury. You risk a needle stick because something's going to get caught in those extra rolls. It's too big. Make sure the glove fits snugly but not too tight. On 70, proper glove removal, you're going to highlight. Lab coats and scrubs, you're going to highlight. Gowns, you're going to highlight. On 71 is the picture that I was telling you about of how you take your gloves off. Read through it. We'll go over it on Tuesday. On 72, putting on your gowns, highlight. Gown removal, highlight. Masks, face shields, and goggles, highlight. It's a picture right there on 3.5 that shows you how to gown up. Respirators, highlight. Remove the sequence for donning and removing your PPE, highlighted. Okay? Isolation procedures on 73, highlighted. Okay, so you have your protective and reverse isolation. You have your universal precautions on 74. Okay, on 75 is your standard precautions. Pay attention, read it. 76 is your respiratory hygiene and cough etiquette. Read it. Safety is the most important thing for you and your patients. Highlight on 76 your airborne precautions and your droplet precautions and your contact precautions. On 77, read through that table. '78 is another table to read through. '79 is your airborne precautions. And they look a little different in the hospitals, but this is basically what's going to be on the door to tell you what you need before you go in that room. Please read it. 80 droplet precautions. 81 contact precautions. If you look at the bottom of 81, figure 311, that's your biohazard symbol that you need to get used to seeing. Okay. 82 talks about your bloodborne pathogens. Read it. Your exposure to Hep B and Hep C and your vaccinations and all of that, that's right there on 82 and 83. Read it. 84 is talking about HIV. Read it. 84 is also talking about needle stick safety and prevention. Read it. Okay. 86 is your eye wash stations. You need to get familiar with where they are wherever you work. 87 is cleanup. If it's some type of spill or something, it's a cleanup. Okay. 88 talks about your safety data sheets and your how you pay attention to how you're labeling. Make sure you're putting the right labels on the right stuff. 89 is the pictograms and the hazard symbols. Okay. 90 is the DOT hazardous label. 91 is the infection control, is the Fire Protection Association marking system. That's what that is. 92 is the eye wash and the shower station. Figure 317 on 92 is your spill kit. And also 318 is your drug spill kit. Your safety, electrical, fire, all that type of stuff. It talks about your different classes again, and radiation, fire extinguishers. It has your aim, squeeze, and sweep. It has your radiation symbol as well. Get used to those. If you go into 96 and 97, just talks about first aid, shock, things like that. Okay, it goes into your CPR and things like your personal wellness. Okay, on 98, highlight proper nutrition, highlight rest and exercise, highlight personal hygiene, highlight back protection, double time. Also highlight stress management. Read it, understand it. Okay, and then that is it. All right, people. So when we come to class on Tuesday, if it's the Lord's willing, we will brief through chapters 2 and 3 just to make sure y'all understand everything, and then we're gonna move right into 4. Next weekend, y'all will have y'all first test, so get ready. Okay, all right. Haven't decided if I'm gonna put on Blackboard yet or give you one on paper, but I'll let you know by the time. All right, so that's it for tonight, y'all. You have the whole weekend to get all of that done. Get rest, be safe, be careful. Don't forget y'all masks, y'all scrubs, and y'all name tags on Tuesday when you come. And Lord's willing, I'll see you then. Y'all be safe and have a blessed weekend. Be safe and have a blessed weekend.